my name is Laylane Chagas. I'm a physiotherapist, and in this video I'm going to give instructions on how to do stretching exercise for the palm or for the flexors tendons there, and how to work as well on the area of the carpal tunnel to flexibilize that area, or either if you're experiencing some nerve discomfort there, tingling, numbness, or just pain through the arm and hand there, in that distribution, or if it's just that you had a strain or repetitive strain injury that caused pain to the tendons of the hand. Another way you can use this exercise is just good practice to just add more flexibility in the entire upper extremity. You may have just tension in the arm or forearm, but it would be good to add flexibility on the hand in case you feel so much tension coming out from your hand when you do exercise in your arms or forearm. Hi, so as we're discussing, to stretch the muscles in the hand, what you want to do is just to create a space where you can stretch the muscles that are intrinsic to the bones there. Floss the tendons of the palm of the muscles, also the fascia or the soft tissue that covers the palm there over the tendons, and to create an opening stretch of the tunnel, of the carpal tunnel there. This is important for when you have tendinitis of those tendons that flex your fingers, or if you have problems in the nerve that goes through the carpal tunnel, or for whichever reason, swelling or injury in the wrist or in the hand that you want to flexibilize more. So if you do have arthritis, you just need to be more gracious on how much force you put in there. So keeping your palm flat won't mean to just force it flat, because some people will have innate flexion positioning of the hand, and flattening the palm is just a struggle. So you want, regardless if you can touch your palm or not on the table, you can start by just trying to fan your fingers apart like a Spanish fan. And once you do that, you just want to create a traction on tugging or pulling the fingers away from your wrist, and that can create an extra tension. And it's very important to notice the position of the thumb. A lot of people will have the thumb rotated in a way that the nail is facing outwards, not upwards. That's due to tension on the muscle here deep in the thumb called opponent's muscle. If you do a lot of repetitive movement, forceful movement with grip, you may have extra tension in the muscle that will rotate your thumb in that direction. So you want to de-rotate, you want to reposition your thumb, and on that situation, you will try to pull the thumb away and de-rotate, trying to bring the nail up to the ceiling. That won't happen in a day, and that won't happen overnight. So you just gently focus on tugging the thumb towards de-rotating it. If I show this way, de-rotating it towards the ceiling. So in that way you have a stretch position. And the way to progress will be just to bring your wrist, you lean forward, not putting pressure on your hand, but leaning forward, bringing the wrist towards a 90-degree angle. That will add stretch. And if you do add a rotation of your elbow, now just position a little bit higher up here, a rotation of your elbow in and out, you may create an extra tension. If you're finding that's not challenging enough, you don't feel much stretch, another way to add that would be just to add a bowl, or you can get a cloth, fold it, and create just a wedge for you to stretch a little bit more. So you can have like a cereal bowl where you just position yourself there. And here it is, the cereal bowl. So you try to make the base of the hand here, or we call the heel of the hand, as the center of the bowl, not over here, because if you put your middle knuckle here into the center of the bowl, you're going to over bend the knuckles of your fingers, and that may be very painful, and you're not going to achieve much. If you put the carpal tunnel here as the center of the bowl, then you may create a bigger stretch for the entire palm. It's like if you're going to stretch the palm there, the knuckles of the fingers, and also the fingers there. So having the carpal tunnel as the center, you fan your fingers apart, try to stretch out, and then you can create a pumping stretch, a dynamic stretch, as you try to lower your palm towards the bottom of the cereal bowl. Relax your fingers and let the stretch happen. And then in here, you try to move your thumb away from your fingers as much as possible. If you feel tingling, that means you went too far. Back off a little bit, return, and then you pump from a higher level. You shouldn't feel tingling when you do that stretch. If that's too painful, it means that you're not ready for the bowl. You're ready to just flatten your hand into the table. You may add more tension, turning your elbow side to side on a twisting movement. And then you keep trying to move from the table to the cereal bowl. If in the opposite direction, you cannot tolerate the flat palm, or you cannot put a flat palm there, it's okay to start with a claw position. And then if you want to, for more comfort, add a folded cloth into that palm, you can do it, and then you can work towards the fanning of the finger, because that's what you can accomplish for now, because you have too much tension in your palm. Start from there, and then slowly you will remove the height of the cloth, or you're going to be able to spread more and more and more until one day eventually you can flex enough, be flexible enough to flatten the palm there. That just means you gain more mobility in the tendons and the soft tissue in the palm. For the back of the hand, I would never suggest to try to bend the fingers as you're stretching, because that can create cramp into the forearm and cramp into the muscles of the hand. So it's a passive stretch where leaning towards the desk will create the force enough on a relaxed finger to bend that wrist. And if you want, you can bend yourself, help your hand, assist your hand to bend those fingers to create a flossing movement. But that's much better done in another position such as this. Thank you.